right, welcome back to Patient Win Insider. I'm Nick Moen. Today I'm joined by Dr. Sara Dean, owner of Sara Dean Dental and a dentist who's built a reputation for blending calm, compassionate patient care with high-level restorative and aesthetic dentistry. She's been serving her hometown community for nearly 2 decades and shaped a practice culture centered around trust, transparency, and doing the right thing, even when it's the harder thing. Let's get into it. Thanks for coming on, Dr. Dean.
Thanks so much for having me.
So, talking about your joy in dentistry, if you could fill your schedule with just one type of patient or case, what would it be?
A tough question. I think I would have to say patients that value care, not value what their insurance will cover. I want them to be invested in their overall wellness and health, to the fact where they come to me and listen and want to build a partnership in overall health and care, not coming to me expecting to only get and me to follow what insurance sets for them.
Yeah,
I'm a healthcare provider, not an insurance distributor.
right.
So that sort of mindset and culture around them and what they value, when that aligns with mine, it just makes it such a beautiful relationship.
Yeah. And what other frustrations do you see from patients coming in before they receive treatment other than the financial aspect of it?
I think one of the major things I'm hearing and why people seek us out is they don't feel heard. They feel like they come in with an issue, doctors talk to them. I feel like one of the gifts we have here is, obviously I'm here to address what their concerns are, but I also want to hear what do they need, how I can best service them. What is their vision for their overall health today, 6 months, 1 year? That's where you really open the platform to hearing what they value and how you can best service them. And it just builds that open and honest relationship.
Were you kind of aware of that being a strong philosophy for you when you started your practice? And when was it? Was 20 years ago now?
Yeah, so I started in dentistry 2004 is when I graduated. I spent a short stint in South Carolina, but I've owned this practice since 2007.
Wow.
So I've been in dentistry for over 20 years, but I'm coming up on owning this for almost 20 years. I think listening and building true relationships with those people that I serve has always been sort of my inner ethos. It's always resonated with me. I think it's why I've chosen, even in the beginning, I knew I wanted to be in a really boutique private practice where I can treat the patients in the way that services my heart and soul and what I want to give back to the community. And I never really was much of an interest in a DSO for me. I understand they definitely have a place and serve a population, but for me, and I think being very true to myself and what brings me joy means I can pass along that to the patients. And I think it has protected me against burnout.
Yeah. Well, and I guess starting your own practice is no easy feat, right? I'm kind of curious what was a challenge that came up off the beginning and a moment when everything felt risky and then how did it pay off? Like what did you do to manage that challenge?
So I actually bought an existing practice. It was fairly dated, but the doctor that was here was very kind, and patients really loved him. He had been in the community for a long time. But I think the fear was that I always knew I wanted to be technology and very science driven. So I was always sort of on the forefront of, we need to bring this in. So it's very scary in a small town where the patients are used to having dentistry provided to them in a certain way. Here's this young dentist saying, hey, let's really shake it up. It will be better in the long term. Trust me. I mean, building trust takes time, right? So it was really putting myself out there, believing in myself, believing in that we either win or we learn. Failure isn't really a word that exists in my vernacular. So reminding myself of that every day, that it's okay. We might have to pivot sometimes, but bringing in that technology, embracing change, explaining open and honestly why we're bringing this change into patients, and sort of building the cake one level at a time instead of just buying everything I could buy and throwing it in here and totally changing it. We really navigated that change over about 10 years. And now we're one of the most digital, highly advanced dental offices in town. And people now seek us out because of that. But I wasn't the kid in the candy store that bought all the candy at once. I was really careful about my 6-year vision, my 1-year vision, my 5-year vision. and held myself accountable to staying on course and not getting candy hungry.
Yeah. Well, so what sort of, I mean, I don't know, some doctors I've talked to have called them toys, but like what kind of what was the first tools or toys that you got, and like how did that inform what you were going to get next?
So the first toy that I invested in was a digital scanner. I looked at a few of them back then. It was like 2012, so it was
Wow.
quite at the beginning of it. We decided to go all in, took a course, bought the entire system. At that time, I didn't just buy the scanner, I bought the mill, I bought the oven. I'm like, hey, if we're going to do this, I'm going to learn it all at once.
Yeah.
I invested in my staff to come and train with me. So it wasn't me talking to them and telling them, they were really a part of my vision. It's also as a doctor, I guess, not super young at that time, but in the middle, understanding that not everybody is going to be on our same journey 100% of the time, and understanding those team members of mine that saw this and shared this vision with me. And then we had to maybe rehome some of the others that really weren't on this path of growth, which is okay. Keeping that team, and I still have so many of them that were on this vision and really excited about it with me, that really helped the journey be successful.
And how do you, what qualities do you look for when hiring to, I mean, if if turnover is lower, maybe you still have some of the core members in your team that have been there forever. Like, what is it you're
Yeah.
looking for?
I guess the main things is one, teachable. All of us need to remain teachable, being able to hold yourself accountable. We are not going to be perfect on any day. We are all going to make mistakes. But instead of being defensive, coming from a place of, hey, this is what didn't go right, or I did this wrong, hey, that's on me. Owning something is just so kind to those people around you. And once you're accountable for it, it sort of is done. We all make mistakes. Again, keeping that ethos, it's either we win or we learn. We don't shame people around here. But I would say being teachable and approachable and being able to have honest conversations with our team members at all times. If they come from a place of defensiveness instead of learning, that's someone that probably doesn't meet the culture here.
Yeah.
Also, we try to hold ourselves always ethical. It may be a hard conversation to have, but if it's the right one, we're going to have.
Yeah. Well, and maybe does that apply to patients as well? I mean, if they come
Absolutely.
in, yeah. And how do you know if you're like, what's like a red flag? You're like, I'm not doing this case.
It's a red flag. It's also kind of a sense when someone is hyper focused on costs and not in the realms of, hey, how can I afford this? But if you're really trying to fix their oral health or something that's going to really improve their overall wellness, and their entire focus is what's the cheapest way or only what insurance, I know that that's a red flag for me. I can't provide healthcare based on what a company is telling me I can or cannot do that you've decided to, partner with as a patient.
Yeah.
I have to provide healthcare as a doctor that is going to keep you healthy and do the best for your body long term. So that's something that has to align. Also, when someone's really shopped around for us and just been to multiple offices, we really pause. Either we need to learn and listen to them as to what their pain point was. It could be something really easy, but most of the time, I feel like that's a them problem. And they're looking for something that the magic pill that can't be offered. And I really don't want to set myself up for failure.
Yeah, well, but you said you don't believe in failure, right? So more like
Right.
they end up becoming learning experiences, or how do you view?
Yeah, we teach with it. And honestly, I've learned, I mean, every young dentist have made the mistake is, oh, I've got these, you know, I should just do it. I can do it better than the five other dentists. And you realize that that's a real teachable moment. You can only control yourself and what you bring to the table, understanding there's another human that you're partnering with in this patient care. And if you don't align and your values don't align and they're just not accepting what you can provide, it's always the best option just to help them find a dental home that will better serve them instead of going through and setting yourself up for challenges and, difficult conversations in the future. Because if we are very open and honest about complications or things that can go wrong up front, Then when they go wrong, this patient feels prepared if they're willing to hear you. But if they're not willing to hear you, or you don't have those hard conversations up front, and then something or a complication does happen, then they're always looking at you as, well, you didn't tell me, you must have done something wrong.
Yeah.
So that's also, an important conversation to have. And those conversations really weed out the patients that might not be the best patient person for your family, your dental family.
And how do you find the patients that are going to be a good fit?
We don't do any external marketing. So we're pretty much just word of mouth. We have a really beautiful patient family here. Those that have stayed with me, I've had patients that have been with me almost the whole time I've been in practice. And so those patients, they talk about us, they refer people. So word of mouth is always the best when someone's like, hey, this patient referred me to you. And you're like, oh my God, I love that patient. So that's always a beautiful thing. When other corporations or places that we go to around here, restaurants we eat at, and they're like, hey, I met this really great dentist, and they refer somebody. We don't want to just post and advertise for us. That doesn't really feel authentic. We like to have people that really already know what our ethos and our standards and how this practice runs and what we value. And those patients referring people is our favorite way to get new patients.
Yeah. And what is it about that you've built with the patient experience that you feel stands out? Like, what do you feel really proud of in the patient experience? Like, even like walking in the door, what do they expect?
So when they walk in the door, we want them to feel like a weight's lifted off, like we've got you from here. They're always met with a smile. If they're a new patient, obviously we introduce ourselves. If they're not a new patient, they are always greeted by name. We don't really like to even call it a waiting room. Our patients don't wait. We value your time as much as you value ours. So we find it very important. We're not overbooked. We don't triple book or, really double book. From the new patient experience, they get almost over an hour. We discuss everything. They are cared for. They get my utmost attention when I am with them. People aren't going to be disturbing us. We make sure that we really listen to them. We give them the opportunity that this isn't just a quick one-on-one, let me see what I can do on you. It's really, hey, thanks so much for calling us. Why are you here and how can I best service you? That's usually my opening line when I meet someone or I'm in the room with them. Thank you for coming here. How can I best service you? Because sometimes what they need and why they came here might not be the glaring dental problem that's on the x-ray. Sometimes, yes, tooth number 4 is completely broken. It needs something. But they're about to have their daughter get married. And their primary, can we just get my smile beautiful so I can take pictures? Then we'll deal with this. You don't take the time to really have that conversation with the person, you might miss it.
Yeah.
Then they're not going to feel valued and cared for. So that's how we want them to feel and part of our experience. They are not just another number in our patient population. They are whoever they are, and we make sure we care for them and try to really understand what they value and what they need.
Yeah. Well, and as a caregiver, I mean, you must have habits and boundaries that you set for yourself to avoid giving too much, right? Like, what are some of those habits and boundaries that you have in order to stay available?
So, one thing we say is if someone comes in and we tell them what's needed to do and they won't do it, I remind them nicely that a failure to plan on their part is not an emergency on my part.
Sure.
Therefore, if you've been told this is going to be an issue and you neglect to take care of it, don't expect me to then go out of my way to service you on a holiday or a weekend when this might flare up. So that's one hard boundary. I am not a urgent care for dental. I will see you on an emergency, but then you need to establish in my practice that's a hard boundary. You cannot just use me for emergency care. That's not how our office works. You're better suited for a different dental home. Number 2 is uh, words of kindness. You can't speak nasty or down to my staff.
Yeah.
You can be upset, you can be scared, you can be in pain, you can be in a challenging time. We will hold space for that. You cannot be mean, you cannot be rude, you cannot raise your voice, you cannot speak to my staff in a way that they feel that they're being attacked. That's not, I will have a nice conversation with you, like, hey, maybe we need to change this. What is causing this heightened emotion in you? If they just choose to be mean, then they're not really welcome.
Yeah.
So those are probably the hardest boundaries. We want to care for you, but not at the expense of any of us not being treated the way we deserve to be treated as well. We're humans. We have feelings.
Yeah, absolutely. Well, and before you set those boundaries, I mean, did you have moments of feeling overwhelmed and burnt out at any point in owning the practice?
So, to be totally honest, I have never gotten to a point of burnout. I've always been very careful with my self care. I've always had a really great workout routine. I am very blessed to have the best family. They are always available. If you've had a really crappy day, you can call my dad or my sister and they'll help you unpack it. So I've been very blessed to have a safe place to go. I've had days where I've left and I'm like, that didn't feel good. Why didn't, and I talked to myself like, why didn't feel good? Okay, I didn't have that conversation I really needed to have. Or I need to tell the staff, hey, we can't schedule like this. There are definitely weeks that I felt overwhelmed and this is too much. But I've learned and I've really invested in myself to say, hey, it is not a failure on me as a doctor. And my staff has been very good if I tell them I need a break. We need to leave this open for power time.
Yeah.
And it's me doing that and being vulnerable has allowed my staff to come to me and say, hey, I really need this day off, or this life challenge happened. I had to put this animal down and I take 2 or 3 days off. I'm feeling overwhelmed. Can you block out, and we'll allow them to block out an hour, block out their time. So I think I learned that, thank goodness, early on in my career. I think so many young dentists feel like we need to do everything. We have to make money. Oh my gosh, I have all these bills. I just am going to work, work, work. But you can never burn a candle at both ends. You can't. So really learning it's okay. It's not a failure of you and you're letting people down. You're actually showing up as such a great role model for your staff to say, hey, self-care is okay.
Yeah.
And I think because I learned that early, again, there have been times that are hard. I'm not saying it's Pollyanna. I've had those days where I've cried or I've been like, I don't know that I can do this. But that's just a reminder to me, hey, it's time for you to look at the schedule, set those blocks, and tell your staff.
Yeah. And
So,
how do you balance that? Because, you're also running a business. So, like, how do you
yep.
balance that with, making sure you have enough production to see, year over year growth and being able to reach your financial goals as well?
Planning the schedule and setting an intentional schedule is really, really important. That's something I learned quite a few years ago. So my staff knows where what we call rock appointments, meaning those big production appointments, crowns, bridges, implants, are at this part of the day. That's when I'm my best self and can best service those bigger ones. And then we know where to put the little ones, little fillings, less financially beneficial procedures. I think the problem is when you don't have a schedule that everybody knows how to schedule and where things ideally go. The front just puts things here, and then you don't end up having room for a crown or a bridge, and it's just your schedule may look full, but it's not producing enough just
Yeah.
because you have a whole bunch of fillings. So that's where we really designed everybody knows where our rock appointments are, where to put the little things. And it's okay to book some of the little things that aren't going to get that patient in trouble out a few months to save room.
Right.
Also understanding everything ebbs and flows, not to freak out because you had one rough week. If you have openings or holes in the schedule, that is a beautiful time to have your staff do online studies, go through all of the stuff that will make us more production, go through patients that maybe didn't schedule. So there's always room to, even if you don't have a full schedule, that you can help and build the value in the rest of the year.
Yeah. And the attention you're giving to these patients, like what's your hope that when they leave the practice, like, what's your hope that they say about you, like your legacy? What, Dr. Dean, what do they
Oh, my
share with you?
legacy. She really cared about me.
Hmm.
She really valued me and what I had to say. Um, Yeah. I also want them to just say she was kind. Like they could tell I showed up with my heart and I really, really care about the service I provide to my patients and how I care about my staff. Like I spend more time with them than I do with my own family.
Yeah.
But mostly if they could walk away feeling like, man, she was really kind and she really heard me, like those two things are so important.
Yeah. So where do you go from here? Like what are you still trying to learn or refine or improve
Mhm.
over the next, the rest of your time in this practice?
Uh, so I still love technology.
Yeah, yeah, go on.
We are like super into 3D printing, so I would like to get better at that. As a personal goal, like I would love to bring someone in here maybe in a few years that I could go down to maybe working less days per week. I would love to speak to dental students and young dentists how to not just sell your soul to the devil, if you would, go right into the DSO if that aligns with you and that lifestyle is what you wanted. Absolutely. Like we need those corporations to service a population. But if you're just doing it because you're scared of building a brand on your own and starting a practice or buying a practice, I would love to talk to them about how to intentionally do that because I understand there's a huge culture of burnout right now. There are many different factors that align or cause people to have burnout. But I do personally believe that one of the major things is when you're feeling burnout, it's because you're not showing up to your most authentic self every day. You're doing something that's out of line with your true heart and soul and what lives in all of us that makes us us.
Yeah,
Not that you're not going to have a bad day, but you're not following your inner compass.
yeah,
So if you show up every day and it just doesn't sit right what you're doing, like there are ways to get out and I want to help them and empower them. Like if you follow your compass, I can help you get there because patients will see that. And then you don't feel burnout because ultimately you're walking your truth.
yeah. And is that part of your definition of success? What does success look like for you now?
Honestly, like just being light and happy, running into people that are like, oh my God, that's Dr. Dean, like excited to see me even outside of this office, that I've made an impact on this small community where I've moved back to where I was born and raised. So they either know me as my dad's daughter and they saw me grow up here, or now I'm servicing, my friends that we all grew up here. So like making this impact on this community that I love and being able to see people out and them not be like, oh my God, that's my dentist. But like, oh my God, that's Sarah, that's my dentist. And I know all these people from different walks of life, or when people feel like they can even call me when it has nothing to do with dentistry and they're just going through something or they need help, that I would still be the person that they would call because they know I will show up for them. So that would be a legacy that I'd like to. Not that I'm
Awesome.
leaving anytime soon.
Right. No, yeah, you're still cruising. I mean, if it's working, keep
It's
going.
working. Yeah,
Hey, Dr. Dean,
absolutely.
this has been awesome. Thanks for sharing your story and your perspective and
My pleasure. Thank
yeah, your
you.
tidbits of joy with the industry and your patients.
Yeah.
Yeah, until next time, it was great having you on.
Yeah. Thanks for having me.